thing, the part about how to have good sex in the perimenopausal phase is something that no one talks about, and I would include myself as a clinician in that. And it's because we are not talking about looking after the clitoral area. It's not a matter of use it or lose it, which, by the way, is entrenched in medical misogyny, and that medical advice of the lack of sexual stimulation, which contributes to clitoral atrophy, is utterly rubbish. That advice should completely go out. And if you've got a doctor in front of you who's telling you, yeah, just have more sex in the perimenopausal phase, or if it's dry and if it's sore, and doesn't actually give you a treatment plan, you need to get out of their office or find us someone with a better advice for you and get a second opinion, because that is actually the wrong advice. So let me explain to you. Clitoral shrinkage can occur as soon as you're in the perimenopausal phase. So that can start around the age of about 40. I know, just when you thought that you had your life together and you had it all figured out. I mean, I still haven't got it figured out, but that is usually when the perimenopausal phase starts. And that process, which is known as clitoral atrophy or clitoral shrinkage, occurs as part of the genitourinary syndrome of the menopause or vaginal atrophy. And this is primarily due to the significant decrease in estrogen and testosterone levels, which occur by affecting the clitoral tissue and also the clitoral hood as well. Now, we know that when estrogen decreases, it also affects the labia. It can affect the posterior fourchette as well as the perineal tissue as well. But with the clitoral tissue, if it's not getting estrogen, it thins out, it becomes less elastic, and the ability to become engorged with blood, that also becomes affected as well as the sensitivity and the arousal. Let me show you the anatomy behind. If we take this off the vulva, this is how the clitoral sits. So you've got the glands at the end, you've got the clitoral body as well. Now the glands has over 10,000 neurons, and it's incredibly sensitive and sensory, and it's got a good blood supply that goes to it. And this is the urethra, that's where we pee from, and this is our vagina. So as the clitoral body sits there, so this is the pubic bone here, as it sits there, if it's not getting enough estrogen, the blood supply can't engorge the area. Therefore, you're going to have difficulty getting the stimulation that you want. So alongside the reduced sensation, the decreased arousal, you can experience pain as well. The thinning and the drying of all these tissues makes it really painful when you're having sex. It's less enjoyable as well. But don't panic. Low-dose topical vaginal estrogen, which you can get from the NHS GP, allows replenishment of the tissue and the skin cells and the blood supply when we apply it into the vagina. And also, if you want to apply it on your finger around the cream, you can apply it around the clitoris as well. And this will give you, hopefully, your sex life back before it goes away.